Welcome back to our channel. Today we're diving into a surprising topic: why you should avoid spinach if you suffer from certain health problems. Stay tuned to find out more. Spinach is often hailed as a superfood, packed with vitamins, minerals, and antioxidants. But did you know that for some people, it can actually do more harm than good? That's right, this leafy green isn't always the hero it's cracked up to be. In this video, we'll explore 5 specific health issues where consuming spinach might not be the best idea. From kidney stones to thyroid problems, we'll break down the science behind why spinach can be problematic for certain conditions. If you or someone you know suffers from any of these issues, this information could be crucial for your health and well-being. So, grab a seat and get comfortable because we're about to shed some light on why spinach might not be the best choice for everyone. By the end of this video, you'll have a better understanding of how this popular vegetable can impact your health and what alternatives you might consider. Let's get started. Alright, let's kick things off with kidney stones. These tiny, hard deposits can cause a lot of trouble if not managed properly. Kidney stones are hard deposits made of minerals and salts that form inside your kidneys. They can vary in size and shape, and sometimes they can be as small as a grain of sand or as large as a golf ball. They can be incredibly painful and sometimes require medical intervention to remove. The pain often comes in waves and can be severe enough to send you to the emergency room. One of the key culprits in the formation of kidney stones is oxalate, a natural compound found in many foods, including spinach. Oxalates are not harmful in small amounts, but when consumed in large quantities, they can lead to stone formation. Spinach is notoriously high in oxalates. While it's a nutritious vegetable, its high oxalate content can be problematic for those prone to kidney stones. When you consume foods rich in oxalates, they can bind with calcium in your urine to form calcium oxalate stones, the most common type of kidney stone. This binding process can happen in the kidneys or the urinary tract. If you have a history of kidney stones, it might be best to limit your spinach intake to reduce the risk of recurrence. Consulting with a healthcare provider can help you create a diet plan that minimizes your risk. It's not just about cutting out spinach entirely, it's about being mindful of your overall oxalate consumption. Keeping a food diary can help you track your intake and make healthier choices. Foods like beets, nuts, and chocolate also contain oxalates, so it's essential to balance your diet accordingly. Moderation is key to preventing kidney stones. Drinking plenty of water can also help flush out oxalates and reduce the risk of stone formation. Staying well hydrated dilutes the substances in your urine that lead to stones. For those who love spinach but are prone to kidney stones, consider swapping it out for other leafy greens like kale or arugula, which are lower in oxalates. These alternatives can provide similar nutritional benefits without the high oxalate content. This simple change can make a big difference in managing your kidney health. A balanced diet and proper hydration can go a long way in preventing kidney stones. So, next time you're at the grocery store, think twice before grabbing that bag of spinach. Opt for lower oxalate greens and keep your kidneys happy and healthy. Next up, let's talk about gout. Gout is a form of arthritis characterized by sudden severe attacks of pain, redness, and tenderness in the joints. It's caused by an excess of uric acid in the blood, which can form sharp, needle-like crystals in a joint or surrounding tissue. One of the dietary factors that can exacerbate gout symptoms is purines. Purines are naturally occurring substances found in certain foods, and when your body breaks them down, they produce uric acid. Spinach, along with other foods like red meat and seafood, is relatively high in purines. For those suffering from gout, consuming spinach can lead to increased uric acid levels, triggering painful flare-ups. Managing gout often involves dietary changes to reduce purine intake. While spinach is a healthy vegetable for many, it might not be the best choice for gout sufferers. Instead, opt for low-purine vegetables like bell peppers, cucumbers, and tomatoes. These alternatives can help you maintain a balanced diet without aggravating your gout symptoms. It's also important to stay hydrated and maintain a healthy weight, as these factors can influence uric acid levels and overall gout management. So if you're dealing with gout, be mindful of your spinach intake and consider other nutritious options to keep your joints happy and healthy. Moving on, let's discuss thyroid issues. The thyroid is a small gland in your neck that plays a crucial role in regulating your metabolism. When your thyroid isn't functioning properly, it can lead to a range of health problems including hypothyroidism and hyperthyroidism. One group of compounds that can interfere with thyroid function is goitrogens. Goitrogens are substances that can disrupt the production of thyroid hormones by interfering with iodine uptake in the thyroid gland. Spinach, along with other cruciferous vegetables like broccoli and cauliflower, contains goitrogens. For individuals with thyroid issues, consuming large amounts of these foods can exacerbate their condition. If you have a thyroid disorder, it's essential to monitor your intake of goitrogenic foods. While you don't have to eliminate spinach entirely, it's wise to consume it in moderation and ensure you're getting enough iodine from other sources. Foods like seaweed, fish, and dairy products are excellent sources of iodine that can support thyroid health. Cooking spinach can also help reduce its goitrogenic properties, making it a safer option for those with thyroid issues. So if you love spinach but have thyroid concerns, consider steaming or sautéing it to minimize its impact on your thyroid function. Remember, balance is key when it comes to managing your diet and thyroid health. Now let's turn our attention to blood clotting disorders, a topic that is crucial for understanding how our bodies respond to injuries. Blood clotting is a vital process that prevents excessive bleeding when you're injured. This natural mechanism involves a series of complex steps that help seal wounds and promote healing. However, for some individuals, clotting can become problematic. This can lead to either excessive clotting or insufficient clotting, both of which can have serious consequences. Conditions like deep vein thrombosis and certain genetic disorders can lead to abnormal blood clotting, posing serious health risks. These conditions can result in clots that block blood flow, leading to complications such as strokes or heart attacks. One of the key nutrients involved in blood clotting is vitamin K. This vitamin plays a crucial role in the synthesis of proteins required for blood coagulation. Spinach is exceptionally high in vitamin K, which can influence the effectiveness of blood-thinning medications like warfarin. This is why it's important to monitor your intake of such foods if you're on these medications. If you're taking blood thinners or have a blood clotting disorder, consuming large amounts of spinach can interfere with your treatment plan. This interference can lead to either too much or too little clotting, both of which are dangerous. It's crucial to maintain a consistent intake of vitamin K to ensure your medication works effectively. This consistency helps in stabilizing the medication's effect, making it easier to manage your condition. This doesn't mean you have to avoid spinach entirely, but you should be mindful of your portion sizes and frequency of consumption. Moderation is key to maintaining a balanced diet while managing your health. Other leafy greens like lettuce and cabbage have lower vitamin K content and can be safer alternatives. These options allow you to enjoy a variety of vegetables without significantly impacting your vitamin K levels. Always consult with your healthcare provider before making significant dietary changes, especially if you're on blood-thinning medication. They can help you understand the best dietary practices for your specific condition. They can provide personalized advice on how to manage your vitamin K intake while maintaining a balanced diet. This personalized approach ensures that your nutritional needs are met without compromising your treatment. So, if you have a blood clotting disorder, keep an eye on your spinach consumption and work with your doctor to find the best dietary approach for you. Together, you can develop a plan that supports your health and well-being. Lastly, let's talk about iron overload, a condition that can have significant impacts on your health if not properly managed. Iron is an essential mineral that our bodies need to produce hemoglobin, the protein in red blood cells that carries oxygen throughout the body. Without sufficient iron, our bodies can't function optimally. However, too much iron can be harmful, leading to a condition known as hemochromatosis. This condition can cause a variety of symptoms and complications if left untreated. This genetic disorder causes your body to absorb more iron than it needs, which can lead to serious health issues. These issues can range from liver damage to heart problems and even diabetes. Spinach is high in non-heme iron, the type of iron found in plant-based foods. While it is a healthy food for most people, those with hemochromatosis need to be cautious. While non-heme iron is generally less absorbable than heme iron from animal sources, people with hemochromatosis still need to be cautious about their iron intake. Even plant-based sources can contribute to iron overload if consumed in large quantities. Consuming large amounts of spinach can contribute to iron overload, exacerbating the symptoms of this condition. Symptoms can include fatigue, joint pain, and abdominal pain. If you have hemochromatosis, it's important to manage your iron levels through diet and regular medical checkups. Keeping a food diary can help you track your iron intake and make necessary adjustments. Avoiding high iron foods like spinach, red meat, and fortified cereals can help keep your iron levels in check. It's crucial to be aware of the iron content in the foods you consume. Instead, focus on foods that inhibit iron absorption, such as dairy products and coffee, which can help balance your iron intake. These foods can be a valuable part of your diet. It's also beneficial to donate blood regularly, as this can help reduce iron levels in your body. Blood donation is a simple yet effective way to manage iron overload. Always work closely with your healthcare provider to develop a personalized plan for managing hemochromatosis. Your healthcare provider can offer guidance tailored to your specific needs. So if you have iron overload, be mindful of your spinach consumption and explore other dietary options to maintain your health. A balanced diet and regular monitoring are key to managing this condition effectively. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health tips. See you next time. We've covered a lot of ground today, from kidney stones to iron overload, and it's clear that while spinach is a nutritional powerhouse, it's not suitable for everyone. Understanding how certain foods affect your specific health conditions is crucial for maintaining overall well-being. Remember, the key to a healthy diet is balance and moderation. While spinach might not be the best choice for some, there are plenty of other nutritious vegetables that can provide similar health benefits without the risks. Always consult with your healthcare provider before making significant changes to your diet, especially if you have underlying health issues. We hope this video has provided you with valuable insights and practical tips for managing your health. Stay informed, stay healthy, and we'll see you in the next video.